secure is your personal health data? New research is showing that the private medical information of millions of Canadians is being sold to drug companies, and they don't know about it. A study from Women's College Hospital shows that some private clinics are allowing health data companies to access information like your digital medical records. And those companies then sell the data directly to drug companies. For more on those concerns, we're joined by the lead author of this study, Dr. Cheryl Spitoff, family physician and scientist at Women's College Hospital. Great to have you with us on this story. Thanks for joining us.
Thank you for having me.
So your study says that Canada's medical data industry is what you describe a network of complex reciprocal relationships. Explain to us how the system works.
Yeah, sure. So we identified two commercial data brokers, each claiming to have between 1 and 2 million Canadian primary care medical records. From interviews and company documents, we learned that they acquired these records through relationships with for-profit primary care clinics, chains of clinics. For both of them, these two companies, their primary client was the pharmaceutical industry, but they had different approaches to monetizing the data.
And I guess my question is, after looking into this story, is what's the get for the clinics? Because they're not directly selling the information. So what's the benefit to the clinics then?
Yeah, great question. So there's two different models, two different approaches. In the first model, they actually are selling the data. So the chains of clinics sell the data to the commercial data broker who de-identifies the records and then largely makes money by running analytics for the pharmaceutical companies. They also do offer the data sets for sale, but participants told us it was largely through running analytics that they made their money. In the other model, in what we've been calling the vertically integrated model, the data broker actually owns the chain of primary care clinics. And then in this model, they make their money a bit differently. They make their money by developing algorithms for pharmaceutical companies that identify and target patients with drug interventions. So they do this.
Keep going.
They do this in 3 steps. So in the first step, the pharmaceutical company pays the data broker to develop an algorithm that will identify patients who have health conditions that may make them eligible for the company's drug. Then in the second step, with the physician's permission, they run this algorithm on the medical records, identify relevant patients, and then they provide that list of patients along with treatment recommendations to the physicians. And then in the final step, they report that information back to the pharmaceutical company, aggregate data.
And nowhere in any of those information that you've given us do you hear that the patients have any rights or knowledge of what is happening. This is all done between physicians and the companies. Your research also claims that the health data being sold could be worth hundreds of millions of dollars. So what is the risk then to patients?
Yeah, so we've identified a number of risks. One is that this is likely to give the pharmaceutical industry increased control over medical practices. So we're likely to see more of a focus on expensive, new on-patent drugs rather than perhaps just as appropriate or more appropriate older drugs or other treatment modalities like exercise or physio or counseling, less of a focus on prevention and treating upstream causes. We're also very concerned about how the data are being used. Anytime data are being shared, there's privacy risks to patients. And then finally, and I would argue most importantly, this is not how patients want their data to be used. Patients are generally fine with sharing their data if it's going to be used for research and health system improvement, if it's going to be held by a trusted public or nonprofit organization with transparency and oversight and patient involvement. But they're very reluctant to have their data shared or held with for-profit companies.
First of all, I have 2 other questions. First of all, is this legal? Have they found a loophole? And secondly, can a patient when they sit down in an office, say, by the way, I don't want any of my data shared? Do they have that right? And does the clinic have the responsibility then to not share it?
Yes, good question. Sorry. So in the first model, the conventional model, when the data are sold, because they're de-identified, in Ontario at least, they fall outside of the scope of the law. There was a recent ruling from the Privacy Commissioner, and patients are notified, but you aren't able to opt out. So the only real option is not to attend that clinic. In the second model, it's unclear if it's legal or not. The data that are being accessed by the data broker are not de-identified. Physicians are giving their consent to allow this to happen, but I think it's an area that needs transparency and oversight, and we need to, figure out what's happening there and if we need additional legislation and regulation to better protect that data.
Dr. Spinoff, I'll tell you from personal experience, this happened in our family about a year or two ago, where my mom visited a private clinic, turned down a medication because it was too expensive, and then got a call directly from the drug company offering it to her at a different price. And the only thing that we could figure out is it had come from the clinic, how they got her phone number and everything. Wild. So thank you so much for doing the study and for coming on to share it. I appreciate you being here this morning.
Thank you for having me.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.